Well, warmer weather comes eventually, and dropping case counts are out there, ushering in the return of some big events like the White House Easter egg roll and, of course, the Boston Marathon.
It's coming up, but experts are quick to say that the pandemic is not quite in the rearview mirror just yet. Joining us now to answer your questions is Dr. Mark Seidner, an infectious disease specialist at MGH. Dr. Seidner, thank you for being here this morning. We want to ask you, plenty of people are more than ready to declare this pandemic as over. Where do you think we are at this point?
Well, I think we're at the best place we've been for many months, probably about a year. There are very few severe cases of COVID-19 in our hospitals. Deaths are way down from the winter. So this is a good time to get out, enjoy the spring, enjoy the outdoors. Will this be a 2-month lull or a 9-month lull? It's really hard to say. I think most of us have shifted at this point from waiting for this pandemic to end to using all the tools we have to be as safe as possible and what's looking a little bit more like a new normal.
And that is a good thing. Events like the Boston Marathon, certainly big gatherings, but are there still some concerns to think about? Are there precautions that people should be thinking about and taking?
Well, a really important lesson from the last couple of years about COVID-19 is that infections are very rarely reported at outdoor events. So one of the best things about spring and summer is that we can start to enjoy those again. For most people, these kinds of events are going to be completely as safe. Another lesson from the last couple of years is that COVID-19 comes with its own, risks to different people. Some people with immune suppression disorders, people who haven't gotten vaccinated are going to have a higher risk than other people. And it is people like that may want to still consider things like masking and distancing, especially with large crowds or indoor activities, to make sure they're keeping themselves safe.
Speaking of masks, with mask mandates dropping pretty much everywhere now, we're going to be more exposed to germs that we may not have been for quite a while. Is that a concern?
Well, after a completely absent flu season last year, we did start to have one this year in December, and it was starting to peak. But then when Omicron came and people started masking and distancing again, it almost disappeared again, just like it had the year before. I think this really reinforced two lessons for us. One, masks and distancing work, not just for COVID-19, but for all of these respiratory viruses. And two, when we stop doing those things, these infections are going to come back. Many adults have seen these kinds of infections before. They tend to be mild. The kids get the brunt of it. But we now know that as we stop masking, as we stop distancing, we can expect the colds and the coughs to come back as well.
I want to go back to the kid thing. This week, Moderna announced it's moving forward, asking for authorization to vaccinate children under 6. As we wait for that full data, what should parents be considering when they look at that news?
Yeah, so looking forward to the full study data, but these top line results were very reassuring. So kids 6 months up through 5 years of age received a quarter dose of the full adult Moderna vaccine. And after 2 of those doses, they had pretty strong levels of immune boosting, and they had modest levels of Omicron infection, about 40% lower than those who didn't get the vaccine. I think we can expect this data to be submitted to the FDA in the next month or two. They're going to pour over the details along with the CDC. But if it all passes muster, I think we have a potential vaccination for the youngest among us by this summer. As a parent of a 3-year-old who hasn't seen his own grandmother in about 2 years, this information and this advance really couldn't come soon enough.
A lot of parents are waiting. All right, Dr. Mark Seidner, an infectious diseases specialist at Mass General, thank you so much for joining us this morning, as always.